Welcome to the Jeff Crilley Show. Here's Jeff Crilley.
Good Saturday morning, DFW. Our hearts and prayers go out to everybody along the Gulf Coast. I know they were hit hard overnight by the hurricane, and again, they're in our thoughts and prayers. We've got a jam-packed show today, and we're going to begin with spine health with Dr. John Palooza. He's with the Center for Spine Care, and he's an internationally recognized orthopedic surgeon specializing in spine care. Welcome to the show.
Thank you very much.
Were you always interested in work on the spine?
No. I was going to be a fighter pilot.
I
went to the Air Force Academy, and I wanted to fly and eventually be a test pilot and an astronaut. And I lost my pilot qualification because of vision.
Wow.
And so there was a real restricted career path for me in the Air Force, and they wouldn't let me go to medical school. So I decided to resign and then go to civilian school and then eventually medical school and the rest.
Okay, so while you're in medical school, were you attracted to kind of spine care or spine health?
Not initially. I did research in cardiovascular surgery. I did dog surgery for testing different ways to protect the heart on heart-lung bypass. And so I did a lot of surgery then in my freshman year, and I was set to be a heart surgeon.
Wow. So what changed your path?
Like anything, you have mentors that come along. I got to be with the orthopedist, and at that time it was deformity surgery, scoliosis. And I got interested in orthopedics because they were operating on the entire body from the skull to the feet. And you had to be an anatomist as well as an engineer, and it was just incredibly interesting, and the field was really expanding and developing at the time.
Something that to me is fascinating is how quickly we are zooming along. You first started practicing, you told me, in 1990.
Yes.
We're light years away from where you were, just in terms of our knowledge of the body, aren't we?
What I was taught in medical school is medieval now. I mean, it's really antiquated. But it was the beginning, and it's how everything starts. I mean, you just keep developing more and more things as problems arise, and you keep solving them.
And so things that we couldn't have done when you first started practicing are just almost second nature now, huh?
Well, they're done a lot better. When I was first practicing, incisions were very large, exposures were large, a lot of tissue damage. All that's over now. We've developed minimally invasive techniques to the point where all the open surgery can now be done through tiny tubes, utilizing microscopes and endoscopes, intraoperative navigation. We're way better on biologics. The first bone morphogenic protein growth factor was discovered in the mid-'60s, and now we're working on stem cells and growth factors and regenerating tissues.
Wow. And I think the timing of this conversation is especially relevant because of the opioid epidemic. I'm sure you probably see patients that have been nursing an injury for years.
Well, generally, it depends on the injury. Pulled muscles and things like that, as you know, get better pretty quickly. But joints don't. Painful joints that have been damaged don't. They continue to cause chronic pain. And the spine is made up of multiple joints. We try to avoid opiates. We use them short-term after surgery, maybe after an acute injury, but we do more anti-inflammatories and high doses of anti-inflammatory medications to control pain. That's our first move. And we can do that with oral or injection-type techniques to stop the pain so that we can train people out of it.
Our guest is Dr. John Palooza. He's with the Center for Spine Care. Let's talk about the center. When was it born?
About 20 years ago.
And what was tell us about the growth of the center since you...
Well, it's still pretty small. It's a boutique practice. I'm the only surgeon, but we have a team that is very skilled with lots of experience. Matt Chapman, my physician assistant, has been in spine for 20 years. He can work up any problem with the proper physical exam, imaging studies. He's been in all of the surgeries. He knows all the particulars of implants. He's actually been part of one of our patents. He's an incredibly intuitive and mechanical guy. He builds and breaks Broncos in races and Baja races. So he has come up with a lot of our ways to we incorporate them into our design teams. So, and we have our medical assistants, and then our administrative staff who know pretty much every part of spine, from insurance billing to taking all care of patients A to Z.
And as I was doing my homework on you, I went to YouTube and I put in your name, and you've been all over the news for years. I used to work at Channel 4, and I know John Hammerly, our medical reporter at the time, interviewed you quite a bit. Seems like you're always bringing innovation to North Texas. Why don't you talk about some of the things that you've done throughout your career?
Early on, I was developing instrumentation. The first cages, I was involved in the first studies for the interbody cages called the BAK cages, and then the first growth factors was called BMP2, or bone morphogenic protein. It was a way to create bone without taking the patient's bone graft or taking patient's bone to make a fusion heal. And then we got in. I was doing a lot of tumor and reconstructive surgery and complicated infections, working with the orthopedic oncologist. And so I learned how to do, we had to do really hard cases that required thinking out of the box to design new materials, developing different ways to fashion grafts that looked like the pelvis when we had to take the pelvis apart and put the spine back to whatever was left after the reconstruction.
Wow.
So that required more developing of implants and bones and biologics to get these things to heal in a very compromised patient who's fighting a tumor. Then it evolved into doing things smaller. So we start doing more minimally invasive surgery. Then we're operating now through 16 and 18 millimeter tubes to do the stuff we used to do through big incisions. Wow. We've also done a lot of work with endoscopes and endoscopic equipment. All these things that when you change the technique, you have to change all the instruments. So then we start developing ways to figure out where we were in the operating room. An X-ray is a two-dimensional representation of the anatomy. You have to think in 3 dimensions. So now we have intraoperative CT imaging where I can see and think in 3 dimensions real time in the operating room. So we can identify tissue if we're working on a tumor, for instance, or if we're working around nerves. If we're doing a revision operation where the anatomy is completely distorted, I can know where I am by navigating my stuff. And then I can put instrumentation in from the skull to the pelvis with navigation. It's much safer than the old days.
And so with minimally invasive surgery, I guess the recovery time is sped up as well.
Yes. It's gone from now, multiple day, weeks, hospital stays to day surgery. And that's the trend now. A lot of surgery is going to go from the hospitals to surgery centers or 23-hour stays. That's way better for everybody. First off, cost. It's going to decrease the cost of the whole system. Now, developing new technology is expensive, but once it gets going, it goes down rapidly. You've seen that in all kinds of other fields. But also for patients, they don't have the tissue damage and the pain, and that used to be involved in the bigger surgery, so they recover much faster. They don't have the long anesthetics. They don't have the blood loss, those kind of things, so they recover quickly. Most of our surgery is back to work within the week. Wow. If it's a cervical fusion or cervical disc replacement or a soft tissue work around the spine. Now, fusions, no. Lumbar fusions are complicated, complex deformity operations, take much longer to heal. But a lot of the general meat and potatoes stuff that people have every day, you can be pretty confident that you'll get a good result and a quick recovery and back to whatever you want to do. And in these days, getting back to work quickly is very important.
Absolutely. Well, you mentioned stem cell treatment. How does that work?
Stem cells is like the magic word right now. There's the marketing is intense, and it means different things to people. Some people think it's like this magic thing. We just we have a wand, and all of a sudden stuff happens. Stem cells are cells that are immature and then can become other cells. Now, they can become from different sources. Hematopoietic cells come from blood, and so you can develop bloodlines. Embryonic stem cells are so immature that they can become any tissue, but the risk is they can also devolve into a tumor, a teratoma, and they're risky, so we don't do those. You can have tissue-specific cells like nerve cells, or what we use is mesenchymal stem cells. These are from the bone marrow, or from the mesenchymal tissue would be bone, muscle, tendon tissue type tissues. And what they first are is repair cells. They go to a site of tissue injury. They're actually attracted to the site. And then they bring in growth factors and other tissues to repair the damage. The second thing they do is block inflammation. They actually block the inflammatory proteins that cause all the problems at a site. They modulate the immune system. They also you don't need a match between the donor and the recipient. So what that means is you can harvest tissue, characterize it, and expand it in culture or tissue, and then you can give a higher dose. And the cells, so you can actually amplify your intent. So, and then lastly, regeneration is a step too far right now. We're not regenerating, like making a new knee or anything like that. That's going to require other things. It can't be done in this country because of regulatory issues. But in animal models, we've already regenerated, say, a disc and articular cartilage. It's coming. It'll be here in our lifetimes.
That's got to be exciting for you as a physician. Yeah. This breakthrough technology. Well, I ask this of a lot of guests. What is a win for you, and what does it feel like when you, help somebody profoundly? You change their life.
It does make your day. It's great. It's why we keep driving to get better and better and better. We never accept what's okay or what's present today. We're always thinking about the future. When we try to take care of somebody, we work with their body, thinking ahead how their whole life will be affected by this intervention, because the body will respond to what you do. But when you take somebody who's in really big trouble and improve it or make it better or resolve the problem, it is truly exciting. Our clinic is like that every day, and then you see the pictures of all these happy patients all over that. That's our resume. It's on the wall.
Wow. You've been an amazing guest. Will you come back again sometime?
Be happy to.
Okay, and give us the website one more time.
centerforspinecare.com.
Awesome. Thank you so much.
Thank you.
North Texas is known for having a big heart. Next, a preview of North Texas Giving Day on The Jeff Crilley Show.